If you look at Singapore, where they have breakthrough infections, they are just worried that they're going to get severe disease, and that's why they're scaling up their operations to cut back. But I think one of the things that you should notice is that in many of the other countries now that are looking at breakthrough infections, they are moving away from counting the cases and focusing on hospitalization data. Because now you want to know, because basically the vaccine, what it does is it decouples case from severe disease. You're decoupling them. So if you're decoupling it, the decoupling is not 100%, but it is sufficient to give you breathing space. So if you want to look at the success of the vaccination, we will now start having to look at our hospitalizations from COVID-19. So that will be the area that we will be looking at. We haven't to date, and so one area that's a bit informative to us is the deaths, the death toll. So I think you've already mentioned that something like, if you look at the number of all the 671 deaths so far, the number of fully vaccinated persons that have died was 8. It comes to about 1.2%. 1.2% of all those who died from COVID-19 were fully vaccinated. Fully, they were not only fully vaccinated, they had gone 14 days beyond. So they had the full impact of the vaccine. Now that 1.2% has been replicated in many settings. That number of 1.2%. There is always a small risk that there is one group of the segment of population that cannot modulate their immune response as powerful enough as required to prevent them from dying. And this gang, I think these when you look at the group that have the 8, there are people with severe comorbidities. They had age and they also had severe comorbidities. When I ran through the details of the 8, obesity plays a big role in that group. So it's vitally important that, this is why I keep on saying, it's so important that we try to get our people to start to start working on being, if they're fat, at least be fit. Even if you got a big weight, look at getting fit, because being fit just protects you, apart from everything else. So it's so when we're looking at breakthrough infections, it will happen. There is no doubt that we will get breakthrough, and that's what I mean when I say the third wave will be through breakthrough. That's what I mean by the endemic problem becoming an epidemic. It will be through breakthrough infections, through a collection of breakthrough infections. We can do the best we can by doing the booster shots on the vulnerable group. But I think the public can do a much better job if we stay with the COVID-safe measures. The COVID-safe measures in the public, COVID-safe measures at work, and COVID-safe measures in all the gatherings that we have in our social interactions. That at the end of the day, that will still remain the most important intervention that we have.